All right, Jared, thank you so much. You know, it's something that a lot of us don't even want to think about, but it can literally mean the difference between life and death. We are talking about getting screened for colon cancer, and according to medical professionals, more Arizonans die from colorectal cancer than car crashes in our state. That's amazing. March is Colorectal Cancer Awareness Month, and that's why the folks from Vista Medical Center are offering a free seminar today. We're going to talk about that in just a second. But first, I want to introduce you to Lori Slattery. She is one of those folks who didn't want to think about getting checked, but because you did, you're here today. Ladies, good morning to you, and Dr. Sarah Ansello also joining us, and we'll talk to you about symptoms in just a second. But Lori, there are lots of folks at home that this is a subject they don't even want to think about, but you say, don't ignore it.
Don't ignore it. I just, in September of 2015, decided just to do it and
get checked.
Get checked. Everybody said, oh, the prep is so horrible, this and that, and it was no big deal compared to what can happen.
Sure.
You know, I
Good
mean,
point.
So you drink some stuff in the middle of the night and you go in. I was in and out of there in an hour.
And they found something.
They found something. They found a tubular adenoma that was very large. It was up, well, I call it up at the top, but I guess it's the beginning of the colon. I had to have a resection of my colon, my small intestine, and they took out my appendix.
And you know, we should mention, Lori, you have no family history.
None.
You live a very healthy lifestyle. But so you had no real reason to think, oh, maybe I should go do this necessarily, except for just to get checked.
Just to get checked.
Yeah, but now that you have treated it, how are you today?
It's gone. I had my 1-year colonoscopy with Dr. Reddy. He was my GI doctor when I had it, and was clean. Yeah,
well, congratulations. It's great to see you. You look fabulous.
To see you too. Thank you so much.
Dr. Ansello, I imagine you hear stories like this all the time, and I guess the message is go get checked.
Absolutely. You know, as we mentioned, March is Colorectal Cancer Awareness Month. Colorectal cancer is actually the 3rd most common cause of cancer in the United States for both men and women. And it's actually the 2nd leading cause of cancer-related deaths. And that's why screening is so important. Current guidelines actually recommend screening beginning at age 50 for most everybody. There are some groups that are at a little bit higher risk that should be screened earlier. For example, African Americans should start screening at age 45.
Interesting. And then if you have a family history, of course, younger as well.
Exactly.
Let's talk about some symptoms, because this is an area of the body that can be uncomfortable to talk about, but you know what? We've got to do it. So let's talk about some of the things that really should raise a red flag for you. Blood in the stools.
Yes, so blood in the stool, change in the caliber of your stools, abdominal pain or unintentional weight loss. But the most important thing I think to keep in mind is that colon cancer can actually present with no symptoms at all. And that's why screening is so important.
Let's talk about anemia. What do you mean there?
So anemia actually refers to a low blood count because tumors and cancers, they can actually bleed and lose blood over time. So anemia on your lab work or a low blood count can also be an indication you should get screened.
One of the bullet points there, narrowing of stools. What does that mean exactly?
So if there is a mass in the colon, that can actually kind of protrude into the colon, and that will cause your stools to become from their normal size to become a little bit smaller.
Got it. And of course, a change in bowel habits. Let's put up the information about the seminar today, and it is a free seminar to anybody who wants to come. Is that right?
It is a free seminar. It'll be hosted at Vista Medical Center today, and over the course of the seminar, we'll go over some of the risks, how you can reduce the risks, and when you should be screened. I also encourage everybody to talk to their trusted physician, and if they don't have one, we would be happy to answer any questions at the office at Reddy GI Associates in Mesa and Chandler.
Awesome. Well, thank you very much. We'll put all the information on our website as well as our 3TV app. Ladies, thank you.
Thank you
so
for
much.
being vulnerable enough, Lori, to talk about your story and talking about this important subject.
Well, thanks
really
for having us on. We appreciate it.